Well, hello everyone, this is Dr. Schroder with this week's video introduction to week number 3 of our course in educational theory and educational instruction. So once again, a really good week of discussion this week, touching on a lot of different subjects. The primary focus of week number 2 was to review and discuss some of these different styles or some of these different theoretical frameworks that were introduced in a more broad sense in week number 1, and then we talked a little bit more nuts and bolts, and discussed a little bit more, described a little bit more what some of these different concepts mean. Just to wrap up, I think that the discussion was pretty good, and if I were to summarize, one of the things I would highlight is that really all of these theories that we're discussing, or all these different structural frameworks, are very fluid. It's not like most instructors will refer to themselves as being, a strict constructionalist or a full humanist or a progressivist only. It's not usually the terms that are usually used when we're trying to describe how we do curriculum. But when we go and when we look at curriculum and when we look at how curriculum is developed, that's when we can say, you know what, this curriculum over here is really more of a instructor-centered, curriculum-centered instruction. And this one over here, this school over here is doing it differently with a concept-based instruction. And kind of describe an example like how the nuts and bolts of this work. Some of you went to school, no doubt in an ADN program, where you had your semesters broken up into various courses. This is true also if you went to a bachelor, a four-year school. But if you go to a curriculum-based instruction is where you have or curriculum-centered instruction is where you have, for example, a class in nursing fundamentals, and then a class in pediatric nursing, and then another class in mental health nursing, and then maybe a class in gerontology, and then maybe a class in nursing research, and then another class in nursing management and leadership. And over the course of 4 to 8 semesters, you take all these courses, and then at the end of the course you may or may not have a course that's sometimes called the capstone course, or some course that's more like a theoretical integration course. That's an example of a curriculum-centered instruction where you have these different subject areas all being taught in different realms or at different times and not really integrating together. What is becoming more common now, and what is being viewed in many ways as being the evidence-based best practice in nursing education, is concept-based, which is where instead of having individual classes and fundamentals of nursing and advanced nursing and all those, you have courses that are labeled perhaps just concepts of nursing 1. Concepts of nursing 1 may be the entry level, where a student is learning about basic nursing theory, and then learning about basic bedside nursing skills, as it introduced to the terms like holistic and patient-centered care and the meta paradigms, and is maybe learning safety when it comes to passing medication. And then the next semester they take the next course, which is maybe Nursing Concepts 2, which is where they're talking about focusing on providing care to various populations and providing care to the elderly and care to children. And, in other words, instead of having medical, surgical, and pediatric and geriatrics and maternal health, it's all kind of taught together. So that the nursing is all tied together. And this is more person-centered, much more constructivist in concept. Constructivist essentially is a framework that says we start with teaching fundamentals and then, sticking with the same concept, add in assignments and add in new activities that help to build an understanding of that particular concept, as opposed to standalone courses where we're going to teach here a course in mental health nursing and here's a course in maternity nursing. But a lot of things may get lost in between. Where does therapeutic communication fit in? Where does dealing with patients in crisis fit in? Is that a med-surg thing? Is that a mental health thing. Well, really, it's kind of a nursing thing, you know. So it is. Uh, the IOM report reflects that a concept-based curriculum is really the preferred way to teach nursing, and in many ways, it's the way that the NCLEX teaches, or excuse me, the way that the NCLEX uh, test on nursing now. How does a nurse handle problems? How do they problem solve? The best way to really teach those problem solving skills, and the best way to teach that, is from this progressivist, constructivist philosophy. It doesn't mean that other forms of education aren't appropriate or aren't good. It's just that when we're talking about what these terms mean, that's an example of what a curriculum-based or curriculum-focused, curriculum-centered curriculum would look like versus one that is more concept-based and one that is more constructivist and progressivist in tone. So also, that term that I used earlier, I mentioned it in the discussions this week, but when you hear quite often is scaffolding. And scaffolding is when you, as I said, you take that, you're teaching a topic, and rather than just teaching everything all at once and testing on it and moving on, you come back and you revisit it from time to time, building and constructing the knowledge as you go along. But overall, a very good, very robust week of discussion. And this week, in week number 3, we jump ahead a little bit. We're going to be discussing about objectives and how objectives are developed. And so I'm going to leave you to your reading, leave you to the materials to learn about all about objectives. And we'll be discussing that. And you'll be identifying and playing around a bit, as I would say, with developing and coming up with some objectives for a theoretical course or for a practice course that you might want to teach someday. And so that's going to be the focus of this week. For grading, I should have your discussion questions graded probably by midweek, I would imagine. Excuse me. And the papers that you submitted this week on your philosophy of teaching, give me until the weekend. It takes me a while sometimes to grade papers in a class this size. So I'm always hoping that I'll have them done by the middle of the week, but in reality, the way things creep up and the way things happen, maybe by Friday, maybe by Saturday, certainly by Sunday. So by the end of the weekend, you will have the grades on those as well. As always, if you have any questions, feel free to leave them for me in the classroom. It's been a great week. I'm looking for more really good really good discussion, some really good topics coming up, and I really want to commend everybody on your substantiating all of your ideas and all of your concepts with references and with some citations. That is excellent, very professional. So I look forward to seeing you once again in the discussion questions. Let me know if you have any questions, and we'll see you in class.